would like to welcome everyone to this panel at the startup stage. We're here to really talk about building a patient-centric tech company. My name is Jamie Edwards. I am the Chief Platform Officer at StartUp Health. And it's our pleasure to be able to feature some of the innovation happening across this conference and across our portfolio. So with that, I think we should go down the line here. And Yusuf, we can start with you. Introduce yourself and tell us about your moonshot mission.
Cool. Thanks, Jamie. So my name's Yusuf Sherwani. I'm the co-founder and CEO of Pelago. I come from the clinical side of healthcare, so a physician by training. What is Pelago, I guess? So Pelago is the world's leading digital clinic for substance use management. What that means is helping individuals across the acuity spectrum, from prevention through to treatment, engage in substance use care, particularly the most costly individuals, including alcohol and opioid use disorders. Today we partner with payers and employers, covering about 2.9 million lives that are commercially insured, either through self-funded employers or commercial health plans, and then partnering with many of the Fortune 100, over 100 large enterprise employers. The value prop is all about ROI, so we're able to reduce healthcare costs for people enroll in the Pelago program by a factor of about 3 to 1, and that's a total cost of care reduction for people enrolled in the Pelago program.
Thank you very much. Jeff?
Hi, everyone. Jeff Glick. I'm the CEO and founder of Salvo Health, and we're a GI company, so we help the 60 million Americans who face chronic gut health issues, particularly irritable bowel syndrome, and it's not well treated by the American healthcare system, and they're very expensive on the system, but we cover a range of GI conditions. We're the first tech venture-backed company to do provider enablement to GI practices and GI departments at hospitals to enable essentially wraparound care. So imagine mental health services, microbiome, nutritionists, a whole range of services. And we're about to publish research that almost 80% of IBS patients feel better after just 6 weeks in our program. We'll talk more about how we save money for the system. And I'm 2 years into my healthcare journey. I was CEO of Foursquare and ran product and marketing at Travelocity for many years, and love now doing something so mission-driven.
I'll tell you, Jeff, healthcare could feel like a journey, so good to have someone like you in that seat. Shruti.
Hi, everybody. My name is Shruti Gurudanti. I am one of the co-founders of Televëda. My other co-founder was here somewhere, and he, I think, has decided to go grab something to eat. My company, we focus on, our mission is to help alleviate social isolation and loneliness amongst underserved populations. And we essentially have 2 products and ways of achieving this. One is, I was just saying thank you to the VA. We work on helping alleviate suicidal deaths amongst Native American veterans by providing them access to a culturally relevant, evidence-based behavioral health intervention, which is a combination of evidence-based Western medicine combined with talking circles or storytelling interventions, which are specific culturally to our Native American veterans. And the other side is we work with Medicaid and Medicare, so MA plans, in helping alleviate isolation, loneliness amongst rural and our older adult population by teaching them digital literacy and giving them access to tools like devices, broadband access, by going into their homes, teaching them how to use that, and then connecting them to our Televëda platform, which is essentially micro communities of people based on their interest. So we've seen in being in this space since 2018, I've seen it with my own grandfather. I started this company because my grandfather passed away with Alzheimer's, and what really got him wasn't as much the disease as much as it was the isolation and loneliness, him not being able to leave his home. And so the micro communities of people are based on interest because no one wants to admit that they're isolated or lonely. It's a huge stigma. But they will say that, oh, I missed that yoga class, or hell yeah, I want to go play bingo. Connect me to that. And so by connecting people to micro communities of their interest, they stick around, they want to be a part of the community, and they feel like they belong. So that's what we've been doing since 2018, and we're in 26 different states now, and we have an outreach of over about 1 million people.
Thank you, Shruti. Fox.
Hello, my name is Fox. I am the CEO of Next Life Sciences. We're launching the world's first male birth control. That birth control is known as Plan A. It's long-lasting and reversible on demand. A quick 10-minute doctor's visit gives 10 years of thought-free protection. So really helping to solve for the fact that half of all pregnancies are unplanned, and the current burden of birth control is completely carried by women. So we want to alleviate that burden and enable men to be able to participate in family planning.
Thank you, Fox. Raj?
Hey everyone, Raj Amin. I'm CEO and co-founder of Arcade Therapeutics. We are a science-first game studio developing FDA-cleared prescription games to treat mental health conditions. We're really focused on the problem that 50% of people diagnosed with mental illness actually will never seek treatment. A lot of reasons for that. We've talked about stigma being one of those. It's also accessibility. So we're really all about embracing something that already works for consumers, which is the use of gaming as a modality to deliver effective treatment.
Thank you, Raj.
Yeah.
So we're here to talk about patient centricity and what it means to be patient-centric. I mean, we're in healthcare. It kind of feels like that should be obvious, but it's not for a lot of companies. So from that standpoint, what does being patient-centric really mean to you? And I know that a lot of healthcare companies almost patient-centric wash their businesses by saying, well, of course we're patient-centric, but it doesn't mean the same thing to everybody. So Raj, maybe we start with you and come down this way. What does patient-centricity mean to you?
Yeah, I mean, for us, it really means lowering the barriers to access, giving people products that they can fit into their lives, not forcing patients to change their lives to get treatment. So we know that a lot of people don't get treatment because they can't make the time for it. And so what we're really trying to do with our company is think about the patient first and what really can fit into their lives. What can they take with them? What can they get started with while they're waiting for treatment, if they need treatment? How can we get more signal from patients in their own environments by using games on their mobile phones to both get data and deliver treatment? So for us, it's about using what patients are already using, which is games as a modality for the delivery of treatment. Yeah.
Thank you, Raj. Fox, what about you?
Yeah, and Jamie, to your point, it's so obvious that, well, the end user is the patient, so we need to put them first. But I think there's a lot of perverse incentives, especially in healthcare, because there's this idea that a lot of companies should be going towards an exit. And so you don't have to worry about the end user isn't the patient, it's the person that's going to acquire you. At Next Life Sciences, we've really emphasized that the exit and that the buyer is not the concern. It's who's actually going to use it. And some things that we've done that I think are really have been really interesting to see is we bring in the world's leading experts who do these similar procedures, but the majority of the time that we spend with providers are with those who have zero training, because we want to see how are those in a clinic, a rural clinic in some foreign country, right? How are they going to be operating our technology, not just in the hands of experts? The other thing we look at is just the environment. And we're polling our users and saying, our potential users, where are you in the world? What is your environment? Is it hot and humid? How long does it take to get to the clinic? All these things really help to paint a picture that allows us to ensure that the product is designed to meet all of the needs of the users and an incredibly diverse set of men.
Yeah, so it's really about meeting them where they are.
Yeah, and understanding them and talking to them, not making those assumptions. So absolutely.
Thank you. Shruti, how about you?
I really struggle with this concept of, we hear a lot of times payers say that, oh, we have coverage or so-and-so has coverage. Coverage is not healthcare. Coverage is not care. what you really mean by being patient-centric is actually making sure that your patients are using that coverage. And the way you actually make that happen is not some high-tech solution of AI, VR, and I know there are a lot of AI, VR guys here, but what I'm trying to get at is that sometimes simplicity and the simple solutions are what you really need for your patients to get access to the care that they need. So at Televëda, I know we focus sometimes a lot on really things that don't scale, like going to people's home, teaching them how to use that application. I've heard so many people say that social isolation, we have this chatbot AI thing that is going to talk to these patients, and I'm like, okay, who's going to teach them how to use that chatbot AI? And there's no response from the payer. So if you really want to be patient-centric, you want to make sure that your patients are accessing the care that that they deserve, then you have to take that really small step of looking them in the eye and saying, I'm here for you. I'm here to teach you how to use this, and let me bring you along with me in this digital revolution.
I like the concept of patient centricity equaling simplicity.
Yeah, absolutely.
Makes a ton of sense. We have an overwhelmingly complex system, really difficult to navigate, and streamlining that journey makes it more patient-centric.
I have 5 different doctors. Each doctor has a different app. It takes me 5 minutes to understand how to get an appointment. Now think about someone who has arthritis in their 70s trying to get a doctor's appointment. It's nerve-wracking.
Yeah. Jeff, what does patient centricity mean to the team at Salvo?
I think 3 elements come to mind for us on patient centricity: empathy, measurement, and incentives. If you're truly trying to think about how to build a patient-centric company. So when we started, we went and listened to patients, and we started with a virtual clinic where we actually were serving patients out of pocket so that we could learn about needs. I gotta tell you, right now, the existing healthcare system is anything but patient-centric. If you are a typical 28-year-old woman with 5 years of chronic symptoms, you're going to get referred to a GI. They're going to work you up with a colonoscopy and an endoscopy. 99% of the time, you're going to be clear for cancer. And that means today what those people get is, hey, Suzanne, congratulations, you're not going to die. I got to go to my next endoscopy. And Suzanne, typical 28-year-old woman, and it is 2/3 women facing these chronic gut conditions, says, but doctor, I'm miserable. I'm living in hell. 3/4 of the patients have anxiety and clinical depression tied to their gut dysbiosis. And the doctor's like, here's a pamphlet, come back in 6 months. That is not patient-centric care. That is what we have today in America. And by the way, it's really expensive because those patients end up in the ER and they bounce around trying to find a doctor who will actually listen to them and not gaslight their symptoms. And that's expensive. They cost double the average patient. These are mid-acuity patients. So we designed how to fit into their lives, like Shruti talked about and you talked about. So we are not about appointments. You get your own dietitian, your own therapist, and your own nurse over the 6 months that we work with you, and 40 different interventions, and it's 7 day a week. You have access to support. You have sort of digital therapeutics in your pocket every day. You don't have to go to the office. And even the best clinics today, where you might have a nutritionist or a gut-directed psychotherapist, force you to come to the hospital to access that. And there's no follow-up for the next 2 months till you have your next appointment with the nutritionist. We got to help patients more with their chronic conditions. That means meeting them. Real quick, in terms of what you measure gets focus, right? We've all run organizations, so we measure patient satisfaction and we measure outcomes. And so 84% of our patients tell us in the surveys that we're providing a better healthcare experience than they've ever had before in the healthcare system. And almost 80% report symptom improvement after just 6 weeks of treatment. And these are people who've suffered for 3 to 5 years before they found us. And then lastly, incentives. Our incentives, the traditional hospitals' incentives are around RVUs. How many people know RVUs? Relative value units, that's how doctors are evaluated, how many procedures they've done. We don't do procedures. We're oriented to outcomes and the time we spend with patients. And so that's how we're incented, is the time delivering for patients, and we only succeed if you have happy patients who stick with the program. So unlike a lot of physicians or hospitals that are incented to do expensive procedures and move on, we're building a continuous relationship towards health. So that's the three things: the empathy, the measurement, and the incentives and how you design your company to be patient-centric.
I mean, there's the Peter Drucker quote, what gets measured gets managed, right? And when you think about what that means in healthcare today, I think there's a ton of data that we're measuring, but no one's really making it actionable for that end patient. And so you don't end up being a great consumer of it. So it's great to see you putting that data in context. Yusuf, what does patient-centricity mean to you?
So the way I think about building a patient-centric tech company is really, what are the values, the systems, and the operating principles that connect our vision to the day-to-day operations of the business? And I'll explain what I mean by that. Pretty much every tech company, every health tech company is going to have a very laudable vision, right? Ours is no exception. We sort of have this vision for a world where everybody has access to substance use support that works. The question is, how do we make that a reality? Because we're so far from that today. So the way we think about it is, okay, what are the values and operating principles that we're going to incentivize in order for us to get there? I'll give two examples. The first is, how do we create incentives, economic incentives internally to ensure that we're delivering value to our customers, that are self-funded employers and health plans? And we do that with a value-based care sort of system where we know that for us to be successful for our clients, we're going to be delivering a 3-to-1 ROI for them. That's built into our system. If we fail on that, then we get penalized and everybody in the company suffers. But it goes beyond just the economic model as well. It's how do we celebrate and reinforce the values themselves? So we have this value around being member obsessed. And then being member obsessed for us is somebody, for instance, on our care team or our member operations team recognizes that a member with substance abuse issue is going to have their energy cut off. They go out of their way to ensure that their energy is reconnected with their supplier because they know it's going to have negative consequences to that person's continued abstinence if that happens. That then gets celebrated internally because that's being member obsessed for us. That's ensuring that member continues to have great outcomes even if it goes beyond the remit of what we would typically provide to our members. So it's really just bringing those two things together and not just having beautiful values or a vision on the wall that nobody really adheres to.
You're really talking about baking it into your culture and the DNA of the organization, right? All right, Shruti. Being patient-centric is one thing, but being patient-centric with an elderly population is another. What did you have to do to really structure yourself around that population? What were the specific challenges around it? How did you tackle those?
To really deliver value for older adults, or for that matter, any underserved populations, whether it's Native American or it's our Hispanic population, rural population, in order to address their health disparities and their health needs, you have to do things that are not scalable. So we, as a company, are probably not the golden poster child for any of the VC companies, looking here, but we always keep our older adult or our patient first, and we do things that are not scalable so that we make sure that they feel like they can trust us, they're part of the community, and that they are getting the help that they need. So when we work with older adults, we often have to spend a lot of time with them. That requires a lot of patience. So all of our staff on our team has the experience of working with an older adult and teaching them how to use technology. That's sort of the first step that people have to do in order to be a part of the company. I myself have spent over 2 hours once trying to tell an older adult how to click on this iPad lightly because she was clicking on it so hard that a drop down was coming and she wasn't able to figure it out. So all that is to say that it has been a challenge trying to work with older adults. But again, we've always been patient with them, knowing that they have not been lucky like us. We grew up with a lot of technology. They have not. And so suddenly to try to force all this tech on them is difficult. And the way to overcome that challenge is to really listen. I mean, this revolutionary concept of listen. Trust your people and listen to what they're saying. If it's hard, but spend that extra 10 minutes with them. And so I go back to, we have done a lot of non-scalable things. That is going into people's homes, spending 2 hours teaching them how to use the platform and the devices and, the telehealth appointments. And for all the payers out there, who are thinking, or even if you're not thinking about this, I would highly encourage you to think about it. 2024, CMS has come out with a rule that all MA plans have to implement digital literacy assessment tools. So you have to implement a digital literacy assessment tool to see how your members are literate. And if they are not, then you have to provide them with culturally appropriate training skills. So if someone's Hispanic, they have to be taught in Spanish. If someone is speaking another language, it has to be in that language. So all that is to say, MA plans, if this is coming down the pike in 2024 for you, you know that CMS is thinking about this from the perspective of bringing digital literacy to all members in the Medicare, Medicaid space. So I know I'm only talking about, the things that I know of, but if it's an older adult, whether it's technology or anything else, I think the thing that we've learned and would love to tell other people is just be patient and be, kind to them, and that's it.
Love it. Patient and kindness goes a long way. Fox, let's talk male birth control for a second. You are operating in a space that people might be uncomfortable talking about. There might be political leanings. How do you navigate being patient-centric in that environment where there's so much variation in who your patients might be, what their belief systems are, what they're comfortable talking about or not getting embarrassed talking about?
Yeah, it's really interesting. Male birth control is every time. I'm sure everyone's had their own reaction, right? You're like, most people are so excited when they hear about it. Other people have like, oh my gosh, we're talking about sex now. And it's really interesting to see people's reactions. I think the patient-centric is really the saving grace, because I've had so many people that have shared with me. I had an investor, for example, share with me his personal fertility struggle and how he could not invest in a company because he had a fertility struggle. And he's like, you know what, how much money I spent and how much anguish and heartbreak it took to bring a child into this world. Like, I can't possibly be there to help people have birth control. And I'm like, and I challenged him. I said, think about that. Like, half all pregnancies are unplanned. That means that somebody saying, I do not have the resources right now, as a patient, as a person, I don't have the resources, the time, energy, or money to bring a child into the world. And then we're going to say, well, sucks to be you. You have to have a child because an investor out there has had a fertility problem. Like, when you put it in that perspective, it really opens people's eyes. Like, beyond all of the political debate and all of the, the personal feelings that someone might have, somebody saying, I don't have the resources to bring a child. So let's set them up for success and enable them to be able to choose when and if to have a child. And this really has spanned everything from investors to even on the Hill in DC, where everybody wants to make everything political. And you just say, let's take a step back. Whether you are supporting of abortion rights or not, at the end of the day, we can all support that it's better for someone not to be in the position to need an abortion. And when you make it that patient-centric into the person that's involved, not into the big, the population is, plummeting throughout the world, so everybody should be having a whole bunch of babies, right? And you just say, let's set individuals up for success. That's how we enable prosperity, and that's how we deliver a solution that actually is something that's going to impact generations.
It's great, Fox. Thank you. You're going to get some applause, Fox. We should clap for everybody, by the way, when they're done. Let's do that. All right, Raj, you're gamifying healthcare for all intents and purposes. You come to the industry with a huge media background. What is the difference in creating and being patient-centric? Like, what's the difference between a gamer and a patient? How do you make that delineation?
Yeah, so, the good news is, most people play games, right? So we're not trying to teach patients something new. I think that's the key thing. I think the difference is, we put our neuroscience team in the room with game developers, and then the fight starts, and then we break them apart. And then, we have conversations around how do you make science work while still creating engagement. So it's not addictive, it doesn't create stress, it still has science at the core, and I think that kind of push and pull between being sort of game focused, creating games that are engaging, but still allow the science to come through is the key kind of aspect of what we're trying to do. And then you look at all the same metrics, which is, can we get people to achieve the right dosage of treatment over the course of treatment? For us, it's 30 days, 4 days a week, 12-minute sessions that delivers our complete treatment specifically for anxiety, and we had about 90% adherence. So that's sort of the metrics that we look at. In our pilot we did with for our FDA process that completed in the first quarter, we showed 68% of patients that were in the test group dropped a full clinical level of anxiety. So that's the other part, is did the game deliver the clinical outcome that we wanted to see? 38% of those patients dropped to fully subclinical levels of anxiety, and 90% of patients had a positive symptom reduction of an average of 33%. That's after 30 days of use of the game. So, we really look at, was the game engaging, did we deliver the treatment, and then do we achieve the clinical outcome?
Yeah,
So,
the outcomes focus is critically important.
yeah.
Jeff, for all intents and purposes, you're a B2B solution, but your end user is the patient. How do you balance those demands as you think about structuring your product, your roadmap, even who you're going to choose as financing partners? I mean, how does that all roll together for you so you can remain patient-centric?
Yeah, Jamie, it's a great question. We come in and we help GI divisions or large GI practices bring these services that they don't offer today. They don't usually have psychologists and therapists and behavior change people. They don't usually have an app with 7-day-a-week support. They don't usually have nurses focused on that. They don't usually have nutritionists and whole nutrition programs. And so, I mean, the good news is when you get privately with these doctors and leading doctors, they'll say, we do a really great job on colorectal cancer screening in America. And privately, they admit we don't really do a great job on the tens of millions of lower acuity patients, and they don't have time for it. There's only 15,000 GIs in the country. So the good news in healthcare, as in so much of life, change requires a couple things simultaneously to be there. It has to make the doctors' lives better. It has to be better for the patients, and it ultimately has to save money for the system or deliver for the system. And thank goodness that we are all trying to fix a system that is so broken that you actually can improve access, improve quality, and save money at the same time, which is kind of remarkable. So, I mean, we feel pretty good about being able to be patient-centric while obviously selling to doctors and hospitals. And particularly as we move into supporting ACOs and population health and value-based care, we're very aligned because, I don't know if I mentioned it, but we did a 2-arm study and we reduced ER utilization among the treatment arm by 79% for GI-related conditions while treating people. So everyone can win. Obviously, we're bringing a point of view from some of the all-star doctors we've assembled on how to do the right care. And I'm sure there will be tensions at points about kind of our more, to your point, kind of holistic and root cause kind of medicine as opposed to only classic, medicine. And so I think that's where there'll be moments of tension. But the good news is everyone admits this is needed and it's a gap.
Thank you, Jeff. Yusuf, you're going to bring us home here into the home stretch. How do you scale patient centricity as your company scales? You guys are growing rapidly. How do you maintain that focus given all the other demands that are on the business?
Yeah, it's a great question. And I think in many ways, if we're asking ourselves that now at this stage, we've almost failed. Because you need to get it right in the first few hires. Like the thing with being, very patient-centric, having a strong culture, it's not something you do, it can't be the last thing you think about. It needs to be the first thing you think about. I think like every founder wishes that they could be in multiple places at once and be involved in every meeting and every decision, but the reality is you can't. So the bulk of decisions get made without your presence, and that's a good thing, right? Because you need to be able to scale yourself and create the systems and processes for an organization that can have much more massive impact than one person. That means, ultimately other people are making decisions. So the question then becomes, how do you create a decision-making framework where member obsession and patient-centricness become sort of the top of the stack? And that's what people are thinking about all the time. That really comes down to just like having a good hiring process, but then also reinforcing your values. So ensuring that you're celebrating and you're shouting out and you're promoting the people that are putting your members first, and you're recognizing the trade-offs that you have to make. Sometimes that means saying no to a particular deal where you feel that that it might have good economics, but it's going to sacrifice something from a member outcomes perspective, and that's going to put something at risk when it relates to your brand and your ability to be a patient-centric company. So I think it really starts on day one. If you can do that consistently for a long time and reinforce those processes, there's no reason that doesn't continue to work at scale.
Right, it's easy as a founder to be reactive instead of proactive, and you guys are being super intentional. I think the intentionality word is an important one here about how to remain patient-centric. I'd like to thank our panel today. If we could give them a round of applause. Raj, Fox, Shruti, Jeff, Yusuf, great work up here. Thank you for sharing your stories with us, and keep up all the great work and pushing healthcare forward.